Happy spring, everyone. Welcome to our Rolling Out E-Bikes with a Safe System Approach webinar. My name is Marianne Hernandez with the California Department of Public Health. My team and I work closely with Caltrans to support the Active Transportation Resource Center, which offers technical assistance, resources, and training, of which this webinar is a part. My fellow Active Transportation Resource Center, California Department of Public Health, long name, colleagues are Victoria Custodio and Alicia Ramos, which I couldn't do my work without. So today, Victoria will be monitoring the questions in the question and answer during the question and answer period. Or if you have questions during the webinar, do put them in the Q&A box. And Alicia will be running the behind the scenes. Individually owned e-bike use and purchases have skyrocketed since 2019. E-bikes provide a means to a faster, more efficient, less sweat way of getting around compared to traditional bicycles. From a public health and active transportation perspective, they offer a cheaper, clean, and equitable means of transportation, allowing people to leave their cars at home. Today, we'll hear from experts on how we can view this carbon-free transportation alternative in a shared road space with a safe systems lens. Next slide. As you can see, we have a full agenda today. We have speakers. We have it divided in this way. Sorry, I'm fumbling here. First off, we have Tiffany Smith, who will be giving us the safe system approach in transportation as it applies to transportation. Then we'll get a national perspective and a California perspective from Ash and Kendra. Then we're going to hear about a new legislated e-bike safety tool from Sergeant Justin Haynes. And then finally, we're going to hear about the California data on e-bike injuries. Next slide. The objectives for today's webinar are learn how to promote e-bike use with a safe systems framework, learn about e-bike safety training tools, and understand the latest data on e-bike injuries. Next slide. For today, we ask that you share your questions throughout the meeting, but put them in the question Q&A box at the bottom of your screen. You shouldn't have a chat box, but if you do, we might miss your questions. So do put them in the Q&A box, and that can happen throughout the webinar. The next thing we ask is once you log off, you'll post-webinar survey will pop up, and we ask that you fill it out. It should take you about 3 minutes. And then finally, just know that this recording, as well as the slides and the resources, will be shared to all people who registered for the webinar. Let's get started. Our first speaker is Tiffany Smith. Tiffany is a program manager with the Vision Zero Network. She is a public health practitioner. Oh, let's see. Okay, I just want to make sure you can share your screen, Tiffany. Tiffany Smith is a program manager with the Vision Zero Network. She is a public health practitioner who works with transportation professionals, advocates, and policymakers to advance health equity, income equity, and racial justice in roadway safety work across the nation. Go ahead, Tiffany. Welcome.
Okay, awesome. Thanks for bearing with me with uploading my slides. And hi, everyone. My name is Tiffany Smith. I'm the program manager for Vision Zero Network. Thank you to Marianne for introducing me and for kicking us off. And many thanks to the Active Transportation Resource Center for inviting me to open up today's discussion. Just a quick overview for folks who aren't super familiar with Vision Zero Network specifically, but you may be familiar with Vision Zero. We are a national nonprofit that helps communities, practitioners, policymakers kind of advance their goals of Vision Zero. And so I like to describe us as kind of being part resource hub, part connector, all on kind of developing and sharing resources on the safe system approach, speed management strategies, health equity, and more. Just a quick overview of what I'll be covering today. I'm going to provide just a brief general overview of the safe system approach and how it differs from the traditional approach. We'll talk a bit about how you can translate the safe system approach in action. What does that look like for planning? Equity implications and considerations, how to operationalize it for equity, and how we can kind of take the safe system approach and apply it to e-bike safety. And so with that, jumping into how the safe system approach differs. I like to describe it, I actually have a public health background, so I like to describe it as kind of like a public health prevention approach to roadway safety, in that it recognizes that people are moving about in imperfect transportation systems that have been designed without safety at the forefront. It emphasizes that people are more likely to behave safely on the road if they are moving through the confines of a built environment that centers safety. And so while this is not only a difference in outlook, its principles differ in a few ways. The first is that instead of focusing on how to prevent crashes, the safe system approach, the goal is not to prevent crashes, but rather to make our system, our transportation system, more forgiving, so that when crashes do occur, they don't result in deaths and serious injuries. So in some ways, it's actually kind of less ambitious than trying to stop all crashes. In addition, instead of trying to regulate human behavior, it is emphasizing designing for human behavior mistakes and limitations. So kind of exerting that we can design our roadways and transportations and systems in ways that encourage safer behavior. For instance, a wide lane, kind of multi-lane arterial road with a high speed limit without a protected bike lane isn't going to necessarily encourage someone to use an unprotected bike lane if they just feel safer biking on the sidewalk. However, a roadway or transportation system with narrowed lanes, a protected bike lane, a lowered speed limit, sidewalks, etc., does encourage that safer behavior. In addition, instead of trying to control speeding, the safe system approach focuses on reducing system kinetic energy. I know this sounds like a little wonky, but basically just this idea, instead of trying to focus on targeting egregious speeders or a few kind of bad apples, we want to focus on collectively slowing down the speed of everybody using the roadway system. Because we know the higher the transfer of energy between a road user, the more likely a crash is going to be fatal or serious. And so we want to design our transportation systems in ways that kind of minimize the impact of that energy. To kind of further illustrate the difference between these approaches, I kind of wanted to show that up top you have the traditional approach, also sometimes referred to as the E's, and then below the safe system approach. And you'll see above you have engineering, education, enforcement, emergency services, etc. But in contrast to the safe system approach, which has safety at the heart of everything, the above essentially does kind of break down into silos. It doesn't necessarily assign a role, whereas with the safe system approach, all of these aspects are working together to improve safe streets. They're all working together to get to safe speeds. In addition, the above kind of implies that they all are or should be utilized equally, and that they are equally effective at minimizing safety risks and improving safety outcomes. And so we actually know that to not be the case, particularly if we look at studies around injury prevention and principles of injury prevention, which kind of overlap within roadway safety and public health. So on this slide, to help illustrate these ideas, I wanted to uplift this new safe system approach pyramid developed by Dr. Ederer from the Centers for Disease Control and Prevention, in which he kind of adapted the health impact pyramid, a very common and popular public health framework, into the safe system approach for roadway safety practitioners. And just as highlighted in the health impact pyramid, the most effective and long-lasting safety interventions are the ones that impact entire communities and don't require a lot of individual effort. So from a public health perspective, right, you could, of course, educate people on how to use a water filtration system, but that also requires a lot of individual efforts, and it is up to an individual to follow the guidelines and also get the guide right. However, when you are able to develop a robust and comprehensive water filtration system with pipes and drainage that everybody can access, that does require a lot less individual effort and impacts the health of an entire community. And so these kind of factors at the bottom of the pyramid, specifically the built environment and socioeconomic factors, they have the furthest reaching, they have the longest lasting, and also the most effective impact on safety and on roadway safety outcomes. And so when we are prioritizing interventions, we want to prioritize those that kind of address these kind of safety features and infrastructure. And in doing so, we can cultivate streets and roadway systems that are inherently self-enforcing, which kind of also can lessen the need and reliance for more punitive downstream approaches like traffic stops and jaywalking citations, or even citations for biking on the sidewalk, which creates both safe and more equitable transportation systems. This is, of course, and I just want to be clear, this is, of course, not to say that education and active measures like enforcement have no place in roadway safety, but they are currently kind of being overused and in ways that are relying on these tools that kind of focus on individual behaviors instead of focusing on addressing the existing safety gaps and root causes that kind of allow these risks to kind of perpetuate. So as I mentioned earlier, with the safe system approach, it recognizes and addresses the fact that people are moving about in imperfect systems. And so we have to think about particularly people in low-income neighborhoods and communities of color who are moving about imperfect environments and are disproportionately exposed to dangerously built environments with poorly designed, high traffic, high speed roads designed to actually speed people through. A lack of sidewalks, limited bike lanes, insufficient street level lighting, and a multitude of other deficiencies. And so, we're seeing these discrepancies in built environment features manifest in safety outcomes, particularly when you look at bicycle-related fatalities. You'll see that Black and American Indian and Alaskan Native communities are disproportionately at risk, safety risk, and are experiencing the highest burden of bicycle-related deaths. If we look at pedestrian safety risk broken down by race and ethnicity, you also see the disparities in safety risk by people walking for Black or African American and American Indian and Alaska Native communities. And as well, if you look at incomes, the rate of fatalities and serious injuries in lower income neighborhoods compared to higher income neighborhoods, you also observe this discrepancy. But this is not just like a trend, we're observing at the overall national level. This is also something we see locally as well. To illustrate this, I just wanted to highlight this high injury network from San Francisco. Here, the high injury network highlighted by these blue lines here just kind of captures where the majority of severe and fatal crashes are occurring in a community. It's a common practice for many Vision Zero communities. And it has been overlaid on top of their metropolitan planning organization's communities of concern, which they've defined as low-income communities, communities of color, seniors, and people who rely on active or public transportation to get around. And you'll see that about 50% of the high injury network is located within a community of concern, while only 31% of all city streets lie within a community of concern. And so that does show like an overrepresentation of these communities on a high injury network. Similarly, in Oakland, this is specifically their bicycle high injury network, represented by the purple lines. You'll see again, the areas deemed as high community of concern areas for safety risk are represented by the darker shade of green, and you'll see that they're most often, the darker shaded green areas are most often interacting with the purple lines, again, kind of underscoring this overrepresentation of these high at-risk communities kind of already being overrepresented on a high injury network. And so unfortunately, I could have taken this from just about any action plan or Vision Zero plan across the country. We are seeing that whenever they're overlaid, that these communities are always kind of being overrepresented in serious injuries and fatalities and on a high injury network. And so with that, we've got to take steps to operationalize the safe system approach for equity. We at Vision Zero Network have developed this framework or definition in a way to kind of adapted from a public health scholar, Dr. Camara Jones, essentially that lays out to prioritize equity in these circumstances. We've got to value all people, communities, and their mobility needs equally. We've got to recognize and rectify transportation decisions that have kind of contributed and perpetuated disparities. And we've got to provide investments in safety policies, practices, and infrastructure according to both need and risk. And in particular, I just want to bring attention to the third point of providing investments according to need and risk. If we know that particularly low income and BIPOC communities are disproportionately exposed to safety risk, we should be prioritizing safety investments, bike lanes, et cetera, in these communities, kind of addressing the bottom levels of the pyramid that I highlighted earlier. This is another, to kind of highlight what this kind of looks like in action, I highlighted some work from Oakland DOT in which they developed this geographic equity toolbox, which is used to help prioritize neighborhoods for safety investments and infrastructure improvements. The layers, in addition to kind of the high entry network and race and income, they also include data on language, displacement and gentrification risk, and exposure to pollution. And so when thinking about what safety interventions to scale up, particularly in low income or BIPOC communities, this is a really great way of kind of assessing which communities to kind of focus these built environment features in. This is just to highlight, in addition to not only prioritizing and tracking how these disparities show up, they're also measuring like where and monitoring where the majority of their investments are going. So just to highlight this, I took a kind of a screen grab from their annual most recent report, I believe, that highlights all of the capital projects constructed in 2022. It's showing a majority have been done in high priority equity areas, as well as quick build projects completed in high priority equity areas. And so when it comes to applying the safe system approach to e-bike safety, I really encourage you to think about which interventions really target these like lower levels of the pyramid. Socioeconomic factors, that might mean improvement and expanding upon the transportation options available to communities, like expanding access to even safe and reliable transit. Built environment focused strategies can include installing leading pedestrian intervals, which allow pedestrians I've seen, but also sometimes I've seen cyclists, which allow them to go before vehicles, kind of minimizing collisions or potential collisions at intersections. You can also retime signals in ways that encourage both drivers and cyclists, depending on which type of cyclist you're talking about, to ride or drive slower so that they hit a green wave. Or you can also lower speed limits where vehicles and all different types of road users are interacting in and mixing with each other. And of course, installing, bike lanes, sidewalks, any separating users in both time and space. And so in working towards our goals of safe transportation options and safer communities, got to really look critically about at whether the safety strategies were uplifting, are really looking and are really yielding the impact that we're seeking. And so if we know with the principles of injury prevention and public health that we have to address the root causes to improve safety, the current approach to how we're doing roadway safety work is actually in direct opposition to that. It's much more kind of focusing on individuals and targeting like individual behavior as opposed to the systemic like failings that cause safety disparities and safety disparities and safety risks. And so just to kind of illustrate that, I think it's not directly taken from this pyramid, but I think it's a really good example of showcasing how you can kind of assess what the most effective kind of long-term and sustainable safety strategy is in a community. And in Oakland, they have developed this framework that assigns a general efficacy score and a general equity score to the different types of interventions, which allows them to assess how best to address a particular safety risk in their community. I talked a lot today, but I just wanted to highlight that a lot of what I talk about is highlighted in a new resource we launched last year, all on prioritizing health equity and Vision Zero planning. You can check it out at www.visionsero.org/health equity. And yeah, that concludes my presentation. I'm happy to answer any questions. Thanks so much.
Thank you, Tiffany. Thanks for that wonderful overview on why the safe systems approach the built environment, especially in under-resourced communities, decreases death and injury, and how that can broaden the view outside of the individual behavior. Thanks so much.
Thank you.
And then I'll go ahead and introduce our next speaker, Ash, and we'll take questions at the end, everyone, or you can type them in the question function at the top. Dr. Ash Lovell leads all things electric bicycles for PeopleForBikes. She directs the policy work related to electric bicycles at the federal, state, and local levels in the U.S. She also leads multiple campaigns, including Hungry for Batteries, the bicycle industry's e-bike battery recycling program, and e-bike Smart, a rider safety education program. Prior to joining PeopleForBikes, Ash brought people together to work on social and environmental projects like urban sustainability and large landscape conservation for the National Park Service. She holds a PhD in environmental sociology and a master's in human dimensions of natural resources from Colorado State University. And I think she's speaking from Colorado today. Welcome, Ash.
Thank you. Sorry, Marianne. I realize that bio has a lot of big, difficult titles and long words. Well, thank you so much for having me today, Tiffany. Fabulous presentation. I learned so much. I'm going to be following up after this as well. As we said, I'm Dr. Ash Lovell. I'm the e-bike policy and campaign director for PeopleForBikes. I'm going to give a quick overview of who PeopleForBikes is, and then I'll go into some really nerdy data about electric bicycle sales, who's riding them, and then we'll talk about safety and e-bike smart, our e-bike rider safety campaign that we launched with the League and multiple other partners last year, League of American Bicyclists. So PeopleForBikes is the bicycle industry's trade association, and our goal is to make the US the best place in the world to ride a bike. It's always good to have big, ambitious goals, and we know that we are not there right now, but we're working on it, and we're working with a lot of the folks that you're going to listen to today to really improve multiple different aspects of riding, whether it's where people ride, what they're riding, how safe they're feeling, all of those pieces. This is just a few of the brands that we represent. We represent over 350 different brands across the country. Many of them hopefully are familiar to you. Some of them may not be. We're not just a full bicycle trade association. We represent a lot of the manufacturers that are making components. And it's my dream job to do this job where I get to bring together all of the big minds in the industry to pull together to create solutions for some of the big challenges that we're facing today. So, as I said, these numbers are a little off, but we have over 350 coalition members. Those are the manufacturers that are part of PeopleForBikes. We operate in all 50 states. We have over 1 million individual supporters. We call them our bicycle army. We do city ratings in terms of how well the infrastructure is set up across the country for cycling. If you want to check that out, go to peopleforbikes.org and check out city ratings. It's a great way to see how your community is doing. And we also represent a whole bunch of retailers that are selling bikes directly to individuals. So I get to work at the federal, state, and local level on all things electric bicycles, whether it's policy or campaigns or anything else. And I'm really excited to be sharing just some of that work with you today in California. So you may have heard these words already. It is our understanding at PeopleForBikes that there's kind of a three-part solution for making the US the best place in the world to ride a bicycle. The first is infrastructure. We need to have safe, connected, and protected infrastructure. Tiffany did a great job going over this, and I'm sure we'll have other folks talking about this as well. PeopleForBikes has a program called the Great Bicycle Infrastructure Project. Talk about a long name. We call it GBIP because it's hard to say. But it's all about connecting local communities with federal funds to get better bicycle lanes built. Policy is kind of my bread and butter. I work on pro-bicycle, pro-electric bicycle policy at the federal, state, and local level, which are really important. We need things like e-bike incentives, and we need classifications, and we need a better understanding of what a definition of what an e-bike is and is not. So that's kind of my big area. And then participation, understanding who's riding, how many people are riding, where they're riding, what they're riding is all important for my manufacturers, of course, but also for the health of the industry and cycling overall. One thing that I'll say, I'm kind of giving away a little bit of my presentation, is that e-bikes are greatly diversifying the types of folks that are riding bicycles these days. And we, as an industry, are very excited about that. So electric bicycles are the fastest growing bike category and have been year over year. They are the best selling electric vehicle in the country, although we don't want to call them vehicles because we want to call them bicycles. They are bicycles. We have a program that is a policy program that's called the 3-Class Campaign, which outlines what is and is not an electric bicycle. I'll go into that a little bit more. But this is a really good reason for good policy because we need to define what an e-bike is so that we can give you the data that shows you that it is the fastest growing category for bicycles. In 2022, data always lags slightly behind. We know that 1 million electric bicycles were sold, and that was in kind of a down year. The projections are that there will be many more electric bicycles sold over the next few years. We know that there were a lot sold in 2020 and 2021. During the pandemic, people realized that cycling was a great way to get outside, and e-bikes were a super fun way to get outside and still get some exercise. So we had a huge boost as the industry during the pandemic, and sales are slumping a little bit now, but we have a lot of hope and faith that those sales will go back up again because we know people are continuing to ride. That gets to our participation piece. We know that 38 million Americans rode an e-bike last year, so in 2023. This is a combination of folks buying electric bicycles, riding bike share like City Bike and others, and as well as renting electric bicycles if they were on vacation, say in Acadia in Maine, which I just went and did last summer. Super fun, highly suggest. So this is a huge amount of the American public that's riding electric bicycles. And we know that it's a much more diverse group of people that are riding e-bikes than traditionally ride what we call traditional bicycles. It's really important to define what is and is not an electric bicycle. So I mentioned the 3-class system before. I'll go into detail on that now. There are 3 classes of electric bicycles. This is on the books in 43 states across the country. 48 states classify an electric bicycle as a bicycle, so able to use all of the same bike lanes and infrastructure as a traditional bicycle. And 43 use the model legislation, which defines electric bicycles according to these 3 classes. So class 1, electric bicycles are pedal assist. The motor will only engage if you're pedaling, and it goes up to 20 miles an hour with a pedal. You can go faster if you're going downhill or something like that, but the motor will cut off once you get up to 20 miles an hour. Class 2 is throttle assist. So you don't necessarily have to be pedaling. You can either push a button or turn the handlebars. Sometimes the throttle is on the handlebars, and that also has a max assisted speed of 20 miles an hour. We know a lot of bicycles that are sold direct to consumer are this type of bicycle. And then class 3 is a pedal assist again. So the motor only engages when you're pedaling, and that can go up to a maximum speed of 28 miles an hour. And these are designed for long distance commuting on roads, not necessarily designed for bike trails, for bike paths, for that type of infrastructure, more for folks that are looking at this type of bicycle for transportation. The Consumer Product Safety Commission has a definition of the electric bicycle that says the maximum wattage could be 750 watts. It can be 2 or 3 wheels. There's really 2 different ways that bicycles are regulated in the US. There's the federal definition from the Consumer Product Safety Commission, which defines what an electric bicycle is at point of sale. And then there's these 3-class definitions, which define how a bicycle can be ridden and where it can be ridden. And usually these are within the departments of transportation at the state level. And I think California was the first state in the country to put this Model 3-class legislation on the books. Obviously, there are other components of an electric bicycle that are slightly different than a traditional bicycle. There's a little computer on your handlebars that'll tell you how fast you're going and your distance and that type of thing. There's a battery, which can either be integrated into the frame or can be connected like this one is. And then there's a motor. And other than that, it's a bicycle. Okay, so I won't go too deep into this data, but if you'll see in yellow, electric bicycles came onto the market a little over 10 years ago and were a small amount of the market share. And our projections are showing that it's going to continue to grow in terms of the amount of electric bicycles that are in our product stream. There's a lot of interest, a lot of enthusiasm for these products in the industry. And as the e-bike director, I'm thrilled to see this data. You can also see 2020 was a big year for bicycles of all kinds. So to our participation piece, who is interested? Who's riding electric bicycles and who's interested in electric bicycles? PeopleForBikes did a study with some collaborators 2 years ago. It was called E-Bike Curious. We like to have silly names, that looked at folks that are really interested in buying an electric bicycle but haven't yet. So just a little bit of data on folks that are thinking about it, and what those demographics can look like. The household income is usually a little over $100,000. These two different age ranges are really interesting, 18 to 24 or over 65. We know 18 to 24 is interested in electric bicycles for a very different reason than the 65 plus crowd is. But it's an interesting, as a sociologist, it's a really interesting set of demographics because there's different ways that folks are riding if you're 18 to 24 or 65 plus. With new technology, it's usually the younger folks that are adopting this type of technology. But what we're seeing with e-bikes is that it's older demographics that are also very interested, because it allows them to continue to stay active, to maybe get back on a bike if they have been on one for a while. 3/4 of the people surveyed owned a non-electric bicycle, and half of them rode weekly. So these are people that ride, relatively consistency. They don't consider themselves natural athletes, but they do love nature, adventure, and healthy lifestyles. I think one of the biggest problems the bicycle industry has faced is that we speak a lot to the diehards, the folks that are either in Lycra every Sunday riding up a big hill, or are, aggressively going up and down hills on their mountain bikes. But what's exciting about electric bicycles is that these really appeal to a much broader section of the population. People are also interested in electric bicycles for different reasons than traditional bicycles. Transportation is a much bigger interest for folks that are interested in buying an electric bicycle than it is for folks that have bought a traditional bicycle. So a lot of people are looking at electric bicycles for car replacement, for efficiency, and for fun. If you haven't ridden an electric bicycle yet, I highly suggest it. It is very fun, whatever type of bicycle you're riding. Obviously, recreation is still a big interest for folks. Cycling in the US has traditionally been seen as more recreation focused and less transportation focused. But on the recreation side, if you are interested in buying an electric bicycle, it's because you want to ride more often, you want to ride with less effort, and you want to spend more time outdoors. I can say personally and anecdotally, both of my parents have electric bicycles, and they are out 3 to 5 times a week, which is amazing. It makes me so happy to see them out enjoying the great outdoors. And they hadn't been doing that before they got these bikes. One of the big reasons people don't buy an electric bicycle is because of the price. When compared to traditional bicycles, electric bicycles are more expensive, especially high quality, certified, safe electric bicycles. So one of the big things PeopleForBikes is doing is working on e-bike incentives. We have hundreds of millions of dollars on the table in e-bike incentives at the state and local level this year alone. And we are looking at the e-bike act at the federal level being reintroduced. So there's a lot of momentum here. And our goal is to make sure that safe and high quality and certified bicycles are available to anyone who wants to purchase them. Why is she saying safe so much? This is why. So one of the big things that we're seeing in the media is a concern around lithium-ion battery safety. You may have seen the articles about New York and the problems there around fires. There's a lot of reasons for this, and I won't go into all of them, but one of the biggest is that battery safety is not guaranteed with lithium-ion batteries. My members certify their products to either the US battery standard or the European battery standard, because many folks sell in Europe as well. And those battery standards have been tested time and time again to show that they create high quality, reliable batteries. But there's a whole bunch of products that are coming into the country that aren't certified to any battery safety certifications. They're doing that by slipping in under de minimis. This is so nerdy, and I'm sorry. And you can follow up with me later. But essentially, there's a loophole at the federal level that says anything under $800 doesn't have to meet the same safety certifications as anything over that threshold. And it's extremely difficult to make a bicycle under $800 that is certified to any reliable standards. So this is something People for Bikes has been working on very closely in New York, both at the city and state level and federally, to make sure that our regulators understand what a good certification standard is and that they get those on the books so we can start really reducing the number of products that are coming in that don't meet these standards. That's going to be a great way to reduce the incidences of fire. All right, to my last section. People for Bikes worked really closely with the League of American Bicyclists and Bicycle Colorado and multiple other bicycle advocacy organizations to create eBike Smart last year. This is all about safe riding. So there's battery safety, and then there's riding your electric bicycle safely and sustainably. Obviously, as we discussed, infrastructure is a huge piece of safety. So the best way to keep people safe is to keep them separated from cars, because we know that those are the majority of the collisions that we see. And it's really good for folks to know what is and is not an electric bicycle. How do you charge and store your battery safety? And what are some tips and tricks to make sure that when you're riding, you're following the rules of the road and that type of thing. So that was our motivation for creating eBike Smart. There are many brands that are supporting this initiative, as well as a whole bunch of advocacy organizations across the country. You can see Cowbike on there. There's a bunch. We're really excited about this. This is really designed to be an introductory class, not something that gives you the full breadth and scope of everything that you could know about your electric bicycle, but more, what's the 101? And it's a free online course that anyone can take. And our hope is that this encourages folks to then go take more educational training, hopefully from the league or from others, on in person, what's the best way to ride your electric bicycle. So we have 5 different sections to this program. The first talks about what is an electric bicycle. So we've already gone over this. It talks about the 3-class system, and it also talks about what's not an electric bicycle. So if your product can go faster than 20 miles an hour with a throttle, it's no longer an electric bicycle, and it needs to be regulated like an electric moped or something that requires registration and licensing. A lot of folks don't know that. If your product can go faster than 20 miles an hour with the speed governor turned off, that also makes it not an electric bicycle anymore. The second section is all about e-bike battery safety. So this doesn't go into the very nerdy certifications. Well, it does. It talks about the types of certifications that are needed for safe batteries when you're purchasing them. But it also talks a lot about what are the best practices when you're charging your battery, when you're storing your battery, and how do you make sure that it has a long and healthy life. We also mention our Hungry for Batteries campaign in this one. This is our program that we launched a few years ago that allows folks to turn in their lithium-ion batteries for a new battery when the battery gets to end of life. We want to make sure that the industry is encouraging sustainable practices related to our batteries, and this felt like the best way to do that. Before you ride. So this is an important piece related to electric bicycles because there are some components on e-bikes that aren't on traditional bicycles. So in this section, we talk about the correct way to set up your electric bicycle, the correct way to get on your electric bicycle, the correct way to use your throttle, as well as how to wear a helmet correctly. The league also contributed their ABC Quick Check to this, which is fabulous. We were so lucky to work with the league on this because they really are the safety experts in the bicycling community, and they did a great job. Rider safety. This is a big one. Obviously, this is what we're talking about today. There's a lot here in terms of important traffic laws, how you follow these, how e-bikes operate differently than traditional bicycles, what it is to have like a little bit more power and speed, being aware that you may wear down your brakes a little faster because you have that power and speed. Those types of pieces are really important when you're just starting to learn how to ride your electric bicycle. And then finally, collision awareness and rider etiquette. If you don't know what a door zone is, this is a great place to learn about it. It's also a great place to learn about lane positioning as well as rider etiquette. If your trail that you're riding on has a speed limit, stick to the speed limit. If you're riding uphill as an electric mountain biker, what are the folks that you need to yield to differently than if you were riding a traditional mountain bike? Okay, tried to go as fast as possible. Thank you so much for the time today. Please feel free to reach out. I think we'll send my email in a follow-up email, and I'm happy to answer questions after this. Thanks so much for your time.
Thanks so much, Ash. Now we know why you call yourself All Things E-Bikes. That was jam-packed with lots of information. And I've been watching the Q&A section, and I think Ash answered a couple of the questions during her presentation, but any that haven't been answered, we'll address later, just so we have time for all our presenters today. Our next speaker is Kendra Ramsey. She is the Executive Director of the California Bicycle Coalition, which advocates for equitable, inclusive, and prosperous communities where bicycling helps to enable all Californians to lead healthy and joyful lives. She has spent the past 15 years working to increase opportunities for everyone to safely bike, walk, and take transit. Raised in a household without a car, she recognizes the opportunities that having access to a safe and reliable transportation options can bring to families. Thanks, Kendra.
Thank you, Marianne. And I really appreciate the prior presentations, a lot of great information. We're very happy to work with PeopleForBikes and appreciate that they did put out that great training set of training videos in the last year. So I definitely encourage folks to check that out. As Marianne said, I'm Kendra Ramsey, Executive Director of the California Bicycle Coalition. We are a statewide coalition of members, that's individual folks, as well as partner organizations throughout the state, including your local bike advocates. In my region, that's the Sacramento area bicycle advocates, but there are many throughout the state that we partner with. We work in a couple different ways to make sure that everyone throughout California has access to places to safely bike. We work on legislation specific to e-bikes. If we're not talking about that today, but if you're interested in that, you can go to our website, calbike.org, and there's information on that there. I know that came in over the chat. We also work on helping to secure funding for infrastructure for people biking, as well as working on different policy and programs throughout the state. We believe that streets are for everyone, people from all backgrounds, all communities, and all ability levels. We want to make sure that California is promoting a healthy climate, and bikes are a great tool for that. We are cognizant and working on many of the things that Tiffany mentioned in her slides about investing in the places that have historically not been invested in. And we like to see all voices included at the table, whether that's folks from the bicycling community, folks that work on transit, folks that work on affordable housing. We like being part of a big tent and work together to make California a great place. CalBike has been around for about 30 years. We brought you the 3-foot passing law in California. We helped define class 4 or protected or separated bikeways. We helped get the legislation to get the 3 classes of e-bikes in the vehicle code that Ash mentioned. And we do a lot of work around e-bike incentive advocacy as well. So that's a few things about CalBike. So Ash mentioned quite a few of these points. Basically, e-bikes are bikes in California. Again, the same definition, it's a bicycle with fully operable pedals and an electric motor of less than 750 watts. Importantly, someone riding a bike has the same rights and responsibilities as someone operating a car in California. And riders under 18 on any type of bike must wear a helmet. In California, there are no age restrictions currently for folks riding class 1 and 2 e-bikes. But you must be at least 16 to operate a class 3 e-bike. So those are just some of the California specific laws for e-bikes for people riding them. Again, very important in the conversation. Not everything that might look like an e-bike is an e-bike. There are a number of ways the California Vehicle Code defines sort of other vehicles and devices. There's motorized bicycles and mopeds, and those are things, as Ash mentioned, that exceed that motor size, that exceed the speed limits that are set on e-bikes, or may not have operable pedals. One of the big differences here is in California, if you are riding what is defined as an e-bike, you're not required to register that with the DMV or have a specific license to operate that. Where those motor-driven cycles, mopeds, the things that don't fall into the categories that Ash discussed, do often require the licensure and registration with the DMV. So those are some important differences there. So one of the big reasons that e-bikes are an important part of the bicycle conversation is that e-bikes help get more people on bikes. Literally later today, this will be me. This image is not me, obviously, but I will be, trying out my e-bike with my brand new child seat that I'm very excited to use. And I was very hesitant to ride my regular bike with my kiddo on the back, just because of my personal circumstances. But it gives extra boost to people who need it, helps people that may not be physically able to ride longer distances, and that little bit of assist is helpful. At CalBike, we get phone calls and emails all the time from people throughout the state who are seeking e-bikes for all kinds of different reasons. We hear lots of those stories. Older folks, as Ash mentioned, are adopting e-bikes in large numbers because it does help them get out there and be physically active again. And it's a great tool for that. It helps people transport cargo. Longer trips and hills are less challenging. Really, there are lots of things that e-bikes can add access to. It can make it a viable option for people to commute to work or other trips that they need. And often that's, something that maybe a household doesn't have a car, and it makes their commute or their everyday trips more straightforward for them and more feasible. And that's where things like e-bike incentives to get e-bikes in the hands of more people is very important. Another factor, accessibility and mobility, is that we see when there are more people on bikes, there's safety in numbers. It becomes more predictable to see someone on a bike. So folks operating cars are more likely to expect them. This image is kind of fun and just shows some adults riding e-bikes, being a passenger on an e-bike, and that can be a culture shift, and bicycling can be seen as a normal form of transportation. And increasing ridership typically will come with an increased demand for better infrastructure. A lot of the changes that Tiffany talked about in the roadway system, so that it can help decrease the likelihood of serious injury and death when a collision might occur. And the more people get out there on bikes and experience what it feels like to use our current roadway network, the more likely it is that they will, add their voices to the conversations that Ash's organization and mine are both part of, where we are working towards getting better infrastructure and improving access in many communities throughout the state and the country. So I greatly encourage folks to check out the different e-bike training resources, the one Ash mentioned, and then I know there'll be another one mentioned later in this presentation. There are, your general rules of the road, as I mentioned. Someone operating a bike has the same rights and responsibilities of someone operating a car. Safety is everyone's responsibility. In California, drivers of cars must give 3 feet to pass. A bicyclist, and they are also required to move to another lane if that lane is available for them to do so. Bicyclists are required to go with the flow of traffic, just like a motor vehicle is. We recommend that folks acquaint themselves with the different types of bike infrastructure that might be present in their communities. There are newer things, including bike boxes, bike signals, and different kinds of bike ways that have sprung up in our communities over the last decade or so, that if folks are picking up a bicycle, an e-bike for the first time since, maybe they rode a bike as a younger adult or a child, those things are new and they're good to learn about. But we also want folks to keep in mind that our roadway network as it currently is prioritizes motor vehicles in many cases. And so the infrastructure that's out there may not be the most comfortable or feel the most safe to them. And so, using common sense and thinking about what route you are using that can help keep yourself safe is always important. Common sense, there's a speed differential with pedestrians and motor vehicles. It's great to report unsafe conditions. Often, locally here in Sacramento, there's things like the 311 app where you report to your local government if there's issues in the roadway. There's lots of ways to help work on requesting new infrastructure. And yeah, just, generally be a good roadway user, use common sense, and be a good driver when you do drive around people on bikes. So a couple of key takeaways for the California Bicycle Coalition about bikes and e-bikes. Bicycles, including e-bikes, are a powerful tool to fight climate change. Transportation is one of the leading sources of greenhouse gas emissions. Personal transportation trips, whether that's commuting, going grocery shopping, taking kids to school. When you can make the choice to do some of those trips by bicycle, walking, or transit, those are great ways to chip away at greenhouse gas emissions. And our government, our state government, and our local city and county governments, making it safe and comfortable for people to do that through improved infrastructure is a critical way we can achieve the state's climate change goals. And as I said, e-bikes open up bicycling for more types of trips for more people. And so they're a great way to sort of make this systemic change for our transportation choices. Safety does require systemic change. Our infrastructure really should make it so that human errors are not causing serious injuries and deaths most of the time. In many of our communities, the infrastructure for people riding bikes and people walking is insufficient and can feel unsafe for many individuals. And so, we also know that serious injuries and fatalities are on the rise for people riding bikes. In many cases, there are car drivers exceeding the speed limit. And so we'd really like to see infrastructure helping to slow those speeds of cars down. We'd like to see the risks lowered for our roadway system so more people can choose to ride a bike. We also suggest folks that, when you're reading news and you're hearing about crashes with e-bikes, that may concern you, but please do be a savvy media consumer. Often what's not reported in those stories is whether the physical infrastructure that someone who was riding an e-bike who may have been involved in a crash, we aren't necessarily hearing whether that infrastructure was safe or appropriate for bicycling, even though it may have been the only facility available. We also often don't hear whether what the conditions were of the person driving, was the motor vehicle exceeding the speed limit or otherwise not contributing to a safe roadway system. So we just, if you hear about e-bike collisions, they are kind of one of the things that is sensationalized in the news. Just kind of ask some of those questions and don't let it dissuade you from considering an e-bike for your transportation needs. And so finally, equity is a huge part of our work here at CalBike. We want to make sure that we're working with many of our community partners in historically disinvested communities and BIPOC communities. Oftentimes the infrastructure in those communities has suffered from lack of investment over decades, and often the high entry networks are in those communities. Tiffany went over these these facts as well, and focusing a lot of the safety improvements in these areas first helps bring the transportation system into a more equitable place, and will help people in those communities adopt the bicycle, which in many cases, folks in these communities are already riding bikes and are disproportionately being impacted by collisions, unfortunately. So that's a huge part of the work, and very critical to making sure that everyone in California can have a bicycle and ride it safely and joyfully. I will be excited to answer questions during the Q&A portion. Our website is calbike.org. Invite you to check out a lot of the resources that have been mentioned today. And please feel free to send me an email if you have any questions that don't get answered later.
Thanks so much, Kendra. And I do strongly recommend become a member of CalBike if you can, and sign up for their newsletter. They have very, very good information in there. And they also, I refer to it, I mean, everything, because I'm all things bike as well. I refer to their newsletter often. It has the latest and greatest. And the CalBike is also, as Kendra mentioned, the leader in making safe bike policy for Californians. So Kendra mentioned some training tools that are out there. And I want to introduce our next speaker, Sergeant Justin Haynes. He has worked with the California Highway Patrol for 19 years and is currently with the Research and Planning Section. He has held various special assignments to include a motor officer and a variety of other investigative positions. Sergeant Hayes currently oversees CHP's radar and LiDAR programs, as well as 7 regional and statewide Office of Traffic Safety grants to help reduce injury and fatality in traffic crashes. And I'll let you take over, Justin.
Great, thank you very much. Thank you for the introduction. Again, my name is Justin Haynes. I'm a sergeant here at CHP headquarters in our research and planning section. I'm actually filling in for Victoria Hunt this morning. She's our subject matter expert in e-bikes and bicycle safety. She unfortunately couldn't be here today. So you give me this morning, and I'm also learning a bunch about bicycle safety that I have not been introduced to. So can you go to the next slide for me? Okay, thank you very much. So I'm going to talk basically about an online bicycle safety training program that we were mandated by law to create, and it is on our CHP website. So just kind of an overview of that. Started with Assembly Bill 1946. It was authored by Assembly Member Tasha Warner and signed by Governor Newsom in 2022. That basically required us, the CHP, to work with various stakeholders throughout the state and develop an online evidence-based best practice safety training for e-bike users. And then also we were required to post a link to that safety training on the CHP's website either on or before September 1st of 2023. The next slide, please. So to begin, we worked with numerous safety stakeholders throughout the state, many of which are committed to bicycle safety and education. And we also work with federal, state, and local government traffic safety partners, and then a few injury prevention coordinators from a couple hospitals here in California. Next slide, please. Thank you. So the bill required us to basically train on 4 things, right? General e-bike safety, emergency maneuver skills, rules of road, and laws pertaining to e-bikes. So next slide. And in talking and working with those various stakeholders that I mentioned, and as well as some internal talks here at CHP headquarters, we decided to expand those training topics a little bit, and we added these things into that training as well. So some of those include some parental considerations and also some health and environmental benefits to riding bicycles. Next slide. Thank you. So I'm going to walk you through how to access that e-bike training on the CHP website. So currently there's two ways of doing that. The first, this is a screenshot of our CHP homepage. That banner on the bottom you see that's highlighted in red, that will be on there for approximately one year. We're about 6 months into that. So you can access it first by just clicking on that. It'll take you directly to the online training. Once that banner goes away, it gets replaced and updated with various things that we do. You can always access the training by clicking on that red box in the upper right corner of the program and services. Click on that link. Next slide, please. And that'll bring you to our program and services page. So by scrolling down to the bottom right corner-ish, you can click on the vulnerable road users icon. Next slide. And that will bring you to the e-bike safety. So that second way will always be available to access our online training. Next slide. This is just a slide basically to show you that you're in the right area. This is the first slide that you'll see when you first sign up for the online safety training course. Next slide. So the course begins basically with an intro why this training was created. And then as well as we thank the many organizations and people who assisted us in building the content. Next slide. This doesn't really do it justice, but there are several interactive portions of this training that was done basically to help keep the user involved in the online training. And then because of that, that's the main reason why we chose the software program too. Next slide. So because e-bikes have become so popular, specifically amongst children and teenagers, we included a section in the training that deals with special considerations for their parents. So we want to ensure that the young riders know the rules of the road, and also recommend that they take an online safety skills and training course just to help them prepare and keep them safer when they're out there riding their bicycles. Next slide, please. This is a pretty good example of one of the interactive portions of our online training. So within the training, you can click on various points of this slide, and it'll display a pop-up depending on where you click, basically, and it'll give the user perspective of what's going on from a motor vehicle point of view or from a bicyclist point of view. So it's good for both people to actually use. Next slide. And then once you're done, there'll be an option for you to download and print off a certificate of completion that you can probably display in your home or office or hallway, wherever you want to put that. Next slide. This is just an additional thing. So along with the online training that we were mandated to create, we also created these two rack cards. So you're looking at front and back of each one here. And one of them deals with basically classifications and health benefits of riding bicycles. And the other one is just kind of some general cycling tips. Both of these rack cards have QR codes at the bottom left-hand corner. And by clicking on those QR codes, it'll link you directly to our vulnerable road user webpage, which will allow you to take the online bicycle training. So next slide. I know that was pretty quick. Again, I kind of got put in this last night. Victoria is our subject matter expert, and for the question answering section, I'm going to point you to her. I'm going to be here throughout the whole training, but she's definitely the expert. She's out today, but any questions you do have, you can transfer to her. So thank you very much,
Justin. Do you happen to know how long your e-bike safety and training is? How long the whole video to take every piece?
I do not have that answer. I'm
okay.
sorry.
Okay, and I did want to mention that Ash mentioned her training. So her training is called e-bike smart. And then we just saw an outline of CHP's training. And then the California Air Resources Board also has a training called Pedal Ahead. And I learned about all these, and I'm sure there are more via the CalBike newsletter. So that gives you another incentive to sign up. So thanks so much. And I love the rack cards. That goes over so many of what of the rules that we've been talking about today about e-bikes. So today, next, we're going to switch over into our data portion to talk about e-bike injuries. I know, as Kendra mentions, that's can be a preoccupation, and this is just to give you a perspective on what the data has shown. We have limited data. So our next speaker, Colin, go ahead and pull up your first slide if you don't mind. Colin Chu is a research scientist working in the Crash Medical Outcomes Data Project here at the California Department of Public Health. We call the Crash Medical Outcomes Data CMOD, and at CMOD, he uses traffic data sets to perform data analysis and produce data briefs. All right, Colin, I'll turn it over to you. Thanks so much.
Thanks, Mary and everyone. Thanks for having me. So my name is Colin Chu. I'm with the California Department of Public Health. I specifically work with the Crash Medical Outcomes Data Project, and I'll be presenting today e-bike and bicycle injury data. Just a little introduction into e-bike and bicycle injury data here on this particular page. The Crash Medical Outcomes Data Staff, also known as CMAD, we analyzed e-bike injuries using the following source data. We used data from the Department of Healthcare Access Information, in particular the 2022 Emergency Department data, and also the 2022 Patient Discharge data, which contains hospitalizations. So according to the Centers for Medicare and Medicaid Services, the International Classification of Diseases Clinical Modification, also known as the ICD-10-CM, is a morbidity classification published by the United States for classifying diagnoses and the reasons for visits in all healthcare settings. So CMOD used ICD-10-CM injury codes to identify e-bike and bicycle-related injuries. E-bike and bicycle-related injuries include ED injuries and hospitalizations, and ED is short for emergency department. The ICD-10-CM e-bike injury codes were recently introduced, so CMOD staff was only able to compile 3 months of e-bike injury data that spans from October through December of 2022. Should be noted that what was included in the data, so we use a term called inclusion criteria, were non-fatal injuries and residents of California. ED injuries include service dates from October 1 of 2022 through December 31 of 2022, and the hospitalization data include discharge dates from October 1 of 2022 also through December 31 of 2022. Here we have a slide that has e-bike and bicycle injuries treated in the emergency department and the hospital. So the table above, it displays that e-bike injuries were 4 times more likely to be treated in the ED than in the hospital, and that bicycle-related injuries were slightly under 7.5 times more likely to be treated in the emergency department compared to the hospital. Based on the data available, bicycle-related injuries were more likely to be treated in the ED compared to e-bike-related injuries. Conversely, e-bike-related injuries were more likely to be treated in the hospital compared to bicycle-related injuries. This next slide here contains the top 5 ICD-10-CM code descriptions involving e-bike injuries. So one of the things that one of the other presenters mentioned was that, e-bike injuries do happen to tend around cars, and the data does display this, as there were 98 e-bike injuries in which e-bike drivers were injured in a collision with a car. But for the purposes of the analysis in this presentation, injuries are the sum of both ED visits and hospitalizations. So that's a good look at this particular chart here. The next slide contains e-bike and bicycle injuries by sex. So the data in this particular table revealed there were slightly over 3 times as many males compared to females who sustained an e-bike related injury, and slightly under 4 times as many males compared to females who sustained a bicycle related injury. With these data available, a greater proportion of females sustained e-bike related injuries compared to those who sustained bicycle related injuries. A greater proportion of males sustained bicycle related injuries compared to those who sustained e-bike related injuries. And here you can kind of see the percentages by breakdown and by sex. This next slide contains a graph with the percent of e-bike injuries by age group. You'll notice that the graph above displays that e-bike related injuries first start in the 0 through 4 age group. They slowly creep up in the 5 through 9 age group as well, and then really peak in the 10 through 14 age group. The 15 through 19 age group also has a large percentage of e-bike related injuries as well, and so does some of the other 20 through 24 and 25 through 29 and 30 through 34 age groups. Here, this particular slide contains the percent of bicycle injuries by age group. So this particular graph, again, kind of paralleling to the last slide, displays that bicycle-related injuries also begin in the 0 through 4 age group, increase in the 5 through 9 age group, and again, peak in the 10 through 14 age group. It should be noted that the 15 through 19 age group also has a large percentage of bicycle-related injuries as well. And within the 20 through 64 age group, that broader 44, 45 years worth of ages, the percentage of bicycle-related injuries hover between 6.1 and 7.6%. So this particular table here describes injuries involving e-bikes and bicycles by race. The data in this table above reveal that the white and Hispanic racial categories compose the majority of e-bike and bicycle-related injuries. The proportion of white individuals who sustained e-bike related injuries was 5.9% greater than those who sustained bicycle-related injuries. Meanwhile, the proportion of Hispanic individuals who sustained e-bike related injuries was 5% less than those who sustained bicycle-related injuries. Next slide. So this particular slide contains injuries involving e-bikes and bicycles by the top 5 counties of patient residence. So this table, it reveals that Orange, Los Angeles, and San Diego counties were among the top 3 counties of patient residence for both e-bike and bicycle-related injuries. The percentage of e-bike related injuries in Orange County is 17.5% higher than that of bicycle related injuries in the same corresponding county. And the percentage of e-bike related injuries in Los Angeles County is 3% lower than that of bicycle related injuries in the same corresponding county. You'll also notice that San Bernardino and Alameda round out the top 5 counties in the hospital patient counties for e-bike injuries and bicycle related injuries. So here's some conclusions for my presentation today. So it should be noted that males and the 10 through 14 and 15 through 19 age groups are at risk for e-bike related injuries. Orange, LA, and San Diego counties are among the top 3 counties of patient residence for e-bike and bicycle related injuries. E-bike related injuries have a slightly greater proportion of females and Californians who are white, and they also have a greater proportion of patients treated in the hospital compared to those treated in the hospital for bicycle related injuries. E-bike related injuries have a sharper peak around ages 10 through 19, and they are more concentrated in those 3 counties mentioned earlier, Orange, Los Angeles, and San Diego counties. These 3 particular counties accounted for 56.2% of e-bike related injuries compared to 35.1% of bicycle related injuries. We should note that there were some limitations to these data because e-bike ICD-10 CM codes were just recently released. There were only 3 months of available data within the 2022 ED and hospitalization data. The next steps for CMOD and the crash medical outcomes data staff will be to continue analyzing more data as they become available. CMOD's goal is to link ED and hospitalization injury data to the California Highway Patrol's CHP's statewide integrated traffic record system, also known as SWITR's data, to learn more about crash circumstances as they pertain to traffic injuries. One final thing I do want to note that's not on this particular slide, my role here is to look at the data objectively through an objective lens and present the data as they are. I work with a lot of traffic data sets, so it was really interesting digging deeper into this data. This particular slide contains my contact information. If you have any questions, feel free to contact me at colin.chu@cdph.ca.gov. Marianne and everyone, thanks for having me. We really appreciate it. And yeah.
Thanks so much, Colin. Very nice presentation. And as Colin, because that's how much we have to do a reliable analysis with. And also, it's important for us to add the data portion to this webinar because, as you all know, transportation and public health is data driven. So it's important for us to present that to you. We have some more data and you'll get a different perspective on analyzing e-bike data. We have 2 presenters who will share the presentation. Our first presenter is Dr. Asha Weinstein-Agrawal. She works at San Jose State University, where she is an education director at the Mineta Transportation Institute and professor of urban and regional planning. Her research explores planning and policy tools to encourage environmentally friendly travel and improve accessibility for people struggling with poverty or other disadvantages. She has explored these issues through micromobility policy, transportation finance policy, travel behavior studies, public opinion surveys, and transportation history. Our second presenter during this portion is Dr. Kevin Fang, an associate professor of geography, environment, and planning at Sonoma State University and a research associate with the Mineta Transportation Institute at San Jose State University. Dr. Fang has been an early researcher in emerging area of micromobility transportation, including explorations of policy, rider behavior, and safety related to bicycle, e-scooter, and skateboard travel. Welcome, Dr. Weinstein-Agrawal and Dr. Kevin Fang.
Thank you so much for that introduction, and I am delighted to be here to share some preliminary results from research that Kevin and I are doing on, we have a larger study on e-bike safety policy, and today we've been looking at data from emergency room records. I also should acknowledge Amelia Lee, who is a graduate student that's been a key partner in our work, and the Mineta Transportation Institute, which is funding the work. Kevin, could you go to the next slide? Thank you. And if anyone is interested, this work is part of a larger project that is set out by California Senate Bill 381, which was Senator Dave Min from Orange County has authored recently. Next. And by the way, I'm going to talk through kind of setting up our study, and then I'm going to turn it over to Kevin to go through what we have learned. But the questions that we were trying to answer with data about emergency room visits is first, what personal characteristics and what were the incident circumstances associated with e-bike injuries reported in a 2022 data set we'll talk about in a minute. And then nextly, to really reflect on how reliable is this emergency room data, specifically if we're trying to understand and hopefully prevent e-bike injuries. Next slide. So first, we're going to talk about this data set we used and the methods, and then Kevin's going to talk about our key findings in response to our 2 research questions, and then finally we'll wrap up with a few conclusions. Next. So NICE, or the National Electronic Injury Surveillance System, is a data set that's produced by, and has been for decades, by the U.S. Consumer Product Safety Commission. And it is explicitly set up to track emergency room visits that are associated with consumer products. And the hospital staff code patient case reports to create this database. Now, the consumer products that are tracked, there's an enormous list that goes from egg beaters to end tables to e-bikes. Although I will notice that this data set does not include injuries related to motor vehicles. And one of the things that's special about this particular data set is that it is a nationally representative sample of 96 hospitals across the country that have 24-hour emergency rooms. And so this is really the only national data set that is designed to allow us to hopefully generalize to the full population of the United States. Next slide. Next. So the data set that we were working with, each person who comes into the hospital ER and is treated or at least does intake paperwork is considered a case. And for each of these cases, there's a number of pieces of sort of pre-coded information we could use that were things like your age, gender, the diagnosis, the body parts that were injured, and where it happened according to some pre-coded categories. What was particularly useful for us, although also very time consuming, was that each case also has what they call a comment. And that is a statement of 400 characters maximum that in theory is supposed to tell us all the details about the accident, the who, what, where, why, when, and also give us information if it's available about the product, brand, manufacturer, and model. And I've put on the side of this slide here just a sample of what one of these comments looks like. They can be pretty difficult to interpret. Some of it's just abbreviations that we did figure out over time, like YOM is 31-year-old male. But unfortunately, the comments often don't provide as much detail as we would like. So here, for example, we're told that an electric bike was struck on the left side, but we have no idea. Was that a motor vehicle? Likely. Was it another e-bike? Who knows? So there's some useful data, but often, unfortunately, not as much as we would have liked. Next slide. So we went through a process for each of these cases to first try and confirm the device type, and Kevin will talk about that in a moment. We were also then looking at these comments to see if we could figure out what was the patient doing when the incident occurred. Were they traveling somewhere? Were they a bystander, and so forth? Also, what were sort of happening that might have been the cause of the injury? So was it a collision with a motor vehicle or a pedestrian, or did someone, for example, just fall without necessarily colliding? And then in some cases, there were additional clues as to other causes of why the fall or the injury collision might have happened, such as swerving or poor quality travel service. And then finally, some of the cases did mention whether the person was wearing a helmet or not. Next slide. And here I'm going to be turning it over to Kevin to tell you about what we learned.
All right, great. Well, thanks, Asha. So now sort of digging here into the data. So some first parts here on sort of identifying who was injured in the various NICE cases. So one wrinkle first off. So as Asha mentioned, there is the lot of product types in the NICE that are captured. So there is no specific e-bike category, but according to the coding manual, they're supposed to be included in this broader code 3215 mopeds or powered assisted cycles. So we had to read the comment section for each of the cases there. And among 1,426 cases in this broader category in 2022, we were able to clearly identify 519 cases that specifically mentioned e-bikes. Among this 519 cases, just some top line demographic information here. Again, we see more male injuries here. So 76% of the cases were among male patients. And then age breakdown here, we did see quite a spread here in ages. We do see quite a number of youth, quite a number of seniors, but the majority of the cases here were between ages here of 18 and 50. So in the younger adult category. All right, so again, so what we were really trying to dive into and particularly try to find out from the data set here was some of the circumstances of the injuries and potentially some of the lessons of the circumstances of the injuries could tell us. All right, so from coding the data set here, so perhaps unsurprisingly, about 91% of the cases involved someone riding an e-bike, which, you know, at first glance it may seem, well, sure, that's kind of obvious. But I think it was also interesting here that not every case of a patient being injured or suffering an injury related to an e-bike was someone riding it. There were a sort of a variety of other cases here. We do see there was a couple percent here of cases of people who were passengers on e-bikes, so sort of contrary to the design of the device. We did see also some cases here of bystanders being injured. Could have been you trip over a bike, a collision with an e-bike rider. It could have been an e-bike user who was injured not riding their e-bike, like they are carrying it down the stairs and they strained a shoulder. So there was a range here of non-riding related injuries on here as well. And then sort of what people were doing when they were injured, or sort of kind of what was the immediate cause of the injury that occurred. A slight majority of the cases we were able to clearly identify as falls. And then a notable second most common incidents we were able to tell here, about 29% of the cases involved a e-bike rider involved in a collision with a vehicle. So we do see the influence here of motor vehicles on safety performance with that item there. The NICE, also being a medical data set, also codes information about the injuries that were sustained here. And again, there was sort of quite a variety of different types of injury types and body parts injured by the people who were seen in the emergency rooms here. So again, sort of spread kind of all across different types of injuries here. If we look at body parts, a plurality there at 19% head injuries, but that does mean 81% non-head injuries. So that wouldn't be addressable, say, with helmet wearing. In particular, if you add up the sort of trunk shoulder injuries, so that's also around a fifth of the cases there. All right, so some of the characteristics here of the injuries sustained. All right, so we have the numbers are what they are. So one thing that particularly became apparent the more we dug into the data here was there were some things to keep in mind when we were looking at the data, and if you run into other research that uses the NICE data set. All right. So one thing we noticed is there are many opportunities for uncertainty to creep in or errors to be made in the data set. So in order for us to get to the final tables we just showed here, numerous steps here that have to occur. The patient has to accurately describe what happened in the hospital. The staff has to accurately write those notes. The nice coder then has to write the comment line, and we saw there was a lot of shorthand in there as well. And then we, as a research team, had to code that information. And so from a sort of policy and transportation planning standpoint, we certainly have things we're interested in that probably, the ER staff and the patient who's injured necessarily are concerned as we're going to be about that information. And then, can some of the stuff that we would like to know is that actually knowable and recordable is another sort of caveat here to the data that exists. All right, so in conclusion here, we just here on this slide here, just some of our top line results from the various data slides we showed a couple of minutes ago. One we didn't have on the previous slide, that sort of Collins data set also was talking about sort of whether patients are treated in the emergency room or were admitted to the hospital for further treatment. A last bullet on this slide, 82% of the cases patient was treated and released. So, but again, here some of our top line figures on the injury characteristics. And then a couple sort of broader takeaways here, sort of lining up here with some of the caveats to the data. There's certainly some stuff we're interested in that the data set told us, some stuff that it didn't tell us here as well. So just a handful of things here that sort of the nice data set here doesn't tell us. So for example, we knew there was about 30% of the cases involved collisions. We don't necessarily know how the motorist was acting. We don't know speeds of the motorist. We don't necessarily know speed of the cyclist. We don't know the infrastructure that was present in those locations, although that stuff is super important, as we've talked about here in other presentations today. We don't know the rates that ER reported injuries occur. That requires additional information of exposure to come up with injury rates, say per trip or per distance traveled. And this is a limitation here to emergency room visits. So we also don't know about other types of injuries that might have occurred that were not seen at an ER, although presumably we're capturing the more severe injuries here as well. However, again, lots of things we can learn from this data set. So I think it does highlight some circumstances that I think appear more frequently and are thus warrant further study. So again, we do see a lot of falls. We do see a fair amount of vehicle collisions. We can also, as we dive deeper, see if there are any variations in circumstances versus various sort of patient characteristics here. And one thing we hope to do next, we have been playing around with this data for a little more than a month here at this point, is compare it to other micromobility devices, bikes, mopeds, e-scooters, so we can sort of see what the how e-bikes compare to other devices that have been more studied. All right, so we'll wrap it up there, and here's our contact information.
Great. Thanks so much, Asha and Kevin. So as a reminder to everybody, this is another data system perhaps you haven't heard about, the National Electronic Injury Surveillance System. And it'll be great to connect that hospital data with Switter's data and all those wonderful things. And we now are in our question and answer period. So I think we'll take the data questions first, if we could, Victoria, and see if Kevin, Asha, or Colin can answer those that have been asked. And then we have quite a few questions, and we have 20 minutes, so hopefully we can get all those. But let's start with our data questions first. Thanks, Victoria.
Sure thing. I'll start with a question for Colin, and this is asking specifically about the denominator data for your data to get rates. The comment from John reads, it's interesting to note how many Latinos are involved in e-bike injuries, the numerator, but it would be more helpful if we knew how many Latinos own e-bikes, denominator. Do you have information to share about the denominator data, Colin, to answer John's question?
Yes. Thanks, Victoria. Yeah, John, to get the denominator data, you would need like the population data from the California Department of Finance to calculate those rates. We presented the percent of, you know, racial categories that were injured. Yeah, I think calculating the rates would take a little bit, you know, more analysis. But that's how you would do that. You would have to, you know, get that population for that racial category by state or whatever population you're looking at.
Okay. Thank you. And I'm going to follow up with the next question. This is also for you, Colin, from another Colin. Why were fatal collisions excluded from the CDPH data set? It seems like that would skew the data quite a bit. Also, what does it mean that so many reported injuries are non-collision injuries? And are these generally lower severity than injuries from a collision? So we have also just behind the scenes have also been communicating with some of Colin's team members. So yeah, Colin, if you wanted to take an, answer that and then, yeah, maybe draw upon some of the other responses that we're sharing offline, that would be helpful too.
Yeah, thanks, Victoria. Yeah, one thing I do want to note is that the e-bike injury data, as well as the bicycle data, we only had 3 months worth of available data based on the newness and the recent ICD-10 CM codes. So to provide you with for example, the number of people who died due to an e-bike related injury in, say, either the hospital and or the emergency department, it would be an underrepresentation of like a whole year's worth of data compared to like 1 or 2 years worth of data. From what I did in like my preliminary analysis, just kind of looking at one of the particular data sets, the numbers are pretty low, so it didn't seem fair to present that. Victoria, what was the other part of the question you mentioned?
Sorry. So the second part of the question was around what does it mean that so many reported injuries are non-collision injuries, and are these generally lower severity than injuries from a collision?
Okay. Well, the data we had available looked at ED and hospitalization data, so I couldn't tell injury severity. Generally, as a rule of thumb, I mean, ED data is more treat and release, whereas hospitalization data looks at more serious injuries. That's kind of why they're in that predicament, unfortunately. So the other thing to note here is that the data that I revealed contains people who, or records of and numbers of people who were injured in e-bike collisions. They weren't necessarily the whole number of crashes, the total number of crashes. And then just to kind of add on what someone else asked, what qualifies as an e-bike injury. So that's the sum of, an ED injury and a hospitalization injury. So those two were combined. Thanks, Victoria.
Sure. Thank you, Colin. Yes, please, Asha.
Yeah, just add a couple of things. I'm not at all expert on the California data, but I'm guessing it shares a lot of similarities with the NICE data. And so one sort of crucial thing is I suspect many of the collisions are not categorized or classified correctly.
Yeah.
And so it's hard to know. I mean, we have the data that we have, but it may well be that more of the injuries were related to a motor vehicle, even if it wasn't coded as a collision. So yeah, just something else to keep in mind.
Thank you so much, Asha. I think it's really important to make that distinction. The other piece is that, I think it's just a really good reminder for all of us. We're introducing these concepts that there's surveillance happening already, but as we heard from all of you, this is very early on, and I think the thought is, none of this is really conclusive yet. But we're really, in this point where we're setting some baseline understanding, and we're recognize the system, the sets that are out there that can really allow us to think about, safety from a data driven standpoint. So I appreciate that clarification, Asha. And thank you, Colin, for answering some of these questions. Okay.
Can we move on? Sorry, Victoria, let's move on to some questions for other speakers. I know they came in as they were speaking. Thanks so
Yes.
much.
Awesome. Yeah, perfect. To that note, yes, I think there's a great question from Piet that I'd like to ask Tiffany to respond to. So Piet's just getting right to the heart of it. And this, I think it's a good recap from your presentation earlier. How specifically does the safe systems approach apply to e-bike safety?
Yeah, thanks, Victoria, for the question, and Pete's for the question. Well, I would say the safe system approach applies really to all road users, and it's really just all about designing our transportation system in a way that allows for safe mobility for people walking, biking, using e-bikes, driving, etc., and taking public transit. And so I guess if I applying it specifically to e-bikes, I would say that means specifically physically separating them from people walking and driving wherever possible, via protected bike lanes, and kind of minimizing interactions between them and other types of road users. Kind of similarly, as I mentioned in my presentation, separating them in space via signal timing and pedestrian intervals. Kind of moving a little bit more upstream, it can mean lowering speed limits and sort of regulations around speeds for e-bikes where they're mixing with people walking and biking, or using regular bikes, I should say. And then even from a high level kind of policy standpoint, this can look like expanding access and affordability to e-bikes that meet safety classifications or have safety features like, I don't know, intelligent speed assistance that prevent people from going above certain speeds, or even collision avoidance detection systems. Or even taking a further step back, just expanding access to safe and reliable public transit options so that everyone has an easy and safe way to move about. It's all kind of the best way I could describe it is just really focusing on addressing and targeting any sort of root cause that stops somebody from being able to utilize the roadway system as safe as they can. Hopefully that's helpful.
That's very helpful, Tiffany. And I will just put a plug in that I, in preparation for this webinar, and just in terms of our collaboration with your organization on Vision Zero and safe systems, we know you do a lot of writing and resource development as well. And so if you ever wanted to work collaboratively with the Active Transportation Resource Center on maybe really drilling down to how the safe systems approach can really be used for all transportation transportation safety initiatives, I think we would welcome that opportunity, but really appreciate that. I did want to ask you right now, and this is not in the chat, but if you'd be willing to share, some of the resources that you talked about like the articles themselves on the safe systems pyramid and that change. I think that's really useful for our audience. And then I also wanted to ask if you could speak at all to the Safe Streets for All program that's out there right now, and how that could be leveraged for maybe safe systems planning, and as part of that, planning for the safety around new transportation users, emerging transportation users, including e-bikes.
Yeah, I'd be happy to share both the article. We also have, just to kind of, not everyone likes reading research papers or research articles, so we also have like a blog post that kind of distills the main point, 2 blog posts that kind of distills the main points of the research article down for like people, all different types of readers. And I'd be happy to share those, I guess, in the follow-up, or we're in my slide notes, whichever is easiest. And then as to your question about the Safe Streets and Roads for All program, we also have a resource for that, like a whole page. But essentially, just for people who aren't super familiar, it's a program awarding $5 billion over 5 years for planning, demonstration, and implementation grants at the local, regional, and even tribal levels for communities of all sizes. It's a bit different from other kind of transportation grant funding in that it allows the funding to kind of go directly to communities instead of having to kind of go around the state. It prioritizes kind of projects in areas that have kind of historically been excluded from transportation planning, like low-income BIPOC communities, but also in programs geared towards people with disabilities and other groups that have historically been overlooked. It does specifically prioritize the safe system approach. And so if you are a planner and engineer and you're hoping to kind of institutionalize this, the Safe Streets and Roads for All program is also like you can apply, I believe, via the planning grant for funding to kind of make those changes in your agency. It also kind of recognizes and supports the need for kind of more nimble projects. Of course, like building a road or a sidewalk, that's always great. But they are also prioritizing funding for more near-term projects like quick builds and demonstration grants. They really want kind of innovative ideas. So some examples I've seen are like piloting a rideshare service in areas like following a major sporting event to minimize impaired driving, developing a racial and health equity like framework or toolkit for your planned safety interventions, or if you have an existing plan, developing like a speed management plan to kind of supplement your existing action plan. So there really are a lot of opportunities to take advantage of. And they've also made it really accessible in that there are 3 deadlines. I believe the first deadline is tomorrow, but specifically for planning and demonstration grants, there are 2 more deadlines. And if you if you have this unsuccessful application for one deadline, you can still reapply for another deadline. So this really is a really unique and unprecedented opportunity for infrastructure funding, but also to kind of test things out, pilot things out. So I hope that's helpful, and I'd be happy to share like our resource page on this as well that kind of distills all of the information available on USDOT's website.
That's great. Thank you so much. All right. So I am going to turn our conversation over to e-bikes on sidewalks. And so I'm going to put this out there for the entire panel, really. But this is Teresa is asking, in my county, there's talk over implementing an ordinance that prohibits e-bikes on sidewalks unless there's no bikeway present or no pedestrians. And I'm wondering what best practices are about e-bikes on sidewalks. Who wants to kick us off? and you might, I probably should have started with this. If you're one of our panelists and able to answer, just take yourself, make sure you're not on mute.
I can take a first pass at an answer.
Thank you, Ash.
From PeopleForBikes. So what we've talked about so much today is the need for better connected and protected infrastructure. And what we're seeing is that a lot of times folks are using sidewalks because they feel safer than riding on roads. And we're also seeing, specifically in California, there's a lot of youth riders that may feel safer being on the sidewalk, but may also not necessarily know that it's not generally within etiquette to ride on the sidewalk. So I think there's a combination of better education, and in another answer, I cited Encinitas and Irvine as great examples of local communities that have education programs with the local schools and parents and youth riders on etiquette for where to ride. But I would also say that, you know, I would rather see a kid riding on a sidewalk and being safe and not being hit by a car than the alternative, which is something that we're also seeing.
Thank you so
And
much.
I can add, this
Sure.
is Kendra from Cowbike. I definitely agree. I think, you know, I tend to avoid riding on sidewalks where I can, but in some cases, it is the safest option. And especially for children who are smaller, they're probably not going to be riding a full-size e-bike, but they may, you know, your middle-sized kiddos might be safer on a sidewalk. And so I think folks riding e-bikes should, again, be aware of the speed differential. If you're riding on a sidewalk, you should be pedestrian speed or slightly above. You should not be going full e-bike speed. And definitely being cognizant of folks who might not see you. But yeah, I think this is definitely in conversation in a lot of our communities. That is a tough
Yes.
issue.
Yeah, and I will say, I think, you know, at the Resource Center, we can probably figure out how to help, you know, find those best practices and develop some resources for disseminating or develop resources that we can disseminate on this idea. I will put a plug in for our colleagues over at UC Berkeley Safe Trek. They've done a wonderful little video, and I'm wondering if any of those Safe Trek friends are on the call or on the webinar, if they could put in the link in the chat, or if not, we can certainly share that out afterwards. But it's just a really good resource highlighting that sidewalk riding is really an equity issue. And so there's, you know, a lot of thought needs to go into it before, you know, setting these rules that, you know, may actually just, you know, do more harm than good. So not to say that they, you know, again, everything is, you know, contextual, but I think this one video I'm thinking about, it can really help, I think, just start a conversation with lots of folks that are, I think, coming in with good intentions, but might not know, you know, really what the impacts of their policy changes might be. So with regard to biking on sidewalks. So, okay. So I think we answered that one, and I'm looking at the time right now, Marianne. What do you think? We're at 11:27. Do you want to we do have records of the chat. We can respond to all of these offline and put the chat in the as one of the resources that we send out. What do you want to do with our time that we
Sure,
have
I
left?
think that's a great idea, Victoria. As Victoria mentioned, when you type a question into the question and answer, we have your name and we can look you up on the registration sheet so we can send you an individual response. If it's a common question, we'll put them in our resources. Let's see, as far as resources, keep in mind, you'll have everyone who registered, not necessarily just attended, will get a copy of this recording, a link to it, a copy of the resources, everything that's been mentioned today. We just heard about, someone asked a question about legislation. I can put that legislation, pending legislation on e-bikes, California legislation on e-bikes in the resource list. I'll put the links to the other training resources. the articles and blog posts that Tiffany just mentioned. So it's a whole slew of resources that you'll get once this is over. We don't expect this webinar to cover everything, especially all your questions. Next slide. So as I mentioned earlier, we're a team of 3. Victoria, Alicia, and I, we are the ATRC staff that work closely with Caltrans. We've divided the state up into 3 parts, and we work with these districts in Northern, Central, and Southern California to on their active transportation program grants and just active transportation in general. And we help produce these webinars. So I want to thank our panelists so much. There was so much information in here. Thank you, Justin, for filling in at 8 o'clock last night. Thank you so much. That's a great training resource. And thank you all, Tiffany, Ash, Asha, Kevin, Kendra, Colin, and of course, Alicia and Victoria. Thank you so much. And you'll be receiving, once you log off, you'll have the survey. So please fill that out and you'll be receiving all our follow-up materials in a week. It takes a little while to get that video available for public viewing. So thank you so much, everyone. Have a good afternoon.